a really important differential word in there, and I want to pull it out, which is baseline studies. Because establishing a baseline, one of the things I talk a lot about with families and people living with something's not right, I'm not sure, or I think I'm fine, is if we establish a baseline on very basic monitoring of ourselves, then we could see whether or not the next time we look, are we still where we were, or is it changing? Because until we establish a baseline, when we look at anybody at a moment in time, it's like, well, I wonder if there's already been some change or if this is their baseline. And one of the challenges at this moment in time for many, many people is they have to self-identify. I think I'm having some symptoms that affect my life in some way. And then we go and try to do a screening. And it's like, wait, shouldn't we have a baseline before we start notice? I mean, it just seems like we are missing a piece, just practical piece. So I would think when we come to imaging, we're even further off the mark because, that then is not even reimbursed yet. And I'm talking about something even as simple as, let's do the animal fluency screen and let's see what your number is. And let's just sort of keep an eye on it and see if it stays pretty much the same, except for maybe a tiny bit of slowing. Let's just look every year and just see if it's, but for many people, there's no such thing, even though, let's say I have a familial tendency toward.
And, and this goes back to several, this is, again, a very multi-layered conversation. We're going back to patients. Memory loss is a sensitive subject for many patients to talk about, and it becomes even more complicated when you bring in the culture and ethnicity and the racial layers to this. My background is I'm Asian Indian. In my culture, to this date, memory loss is a very hush-hush thing. You don't out loud say this in front of somebody who's struggling with these issues, because then the next struggle might be they may not want to go see a doctor because they're afraid that the next thing they know, they will be in a nursing home, which is an absolutely no in my culture. So, yes, I could go on and on about this aspect of how the patients and caregivers are dealing with these at home. And I do apologize. One of the things that and I want to go back to that point, one of the things you had said, you might have seen me take a note as soon as you said that. Of course, in the progression of the disease, it's very hard to say when the disease started, because as we now know, just because you have amyloid plaques does not mean you will develop Alzheimer's or that you have Alzheimer's or that is the reason for your memory loss. Some of the autopsy studies have now shown people could potentially be building up these plaques 20 years, up to 20 before they will start having these symptoms. So it's each individual's baseline. When did they come to the clinic? It's possible that they have progressed into the disease. They might still be asymptomatic with the plaques, and we don't know where they're going to be on the spectrum of the Alzheimer's disease. But again, it's extremely important, as you said, pay attention to your loved ones, pay attention to their symptoms, their behaviors, especially if there's a known risk in your family, whether it's genetic or it's just known through stories in the family. And that's what brings me to this field, is having that very strong history of dementia, which was never diagnosed. But I do remember my grandmother and all of her siblings having the same symptoms of memory loss, never really having the diagnosis. Me knowing I'm at risk, I just don't know which diagnosis am I at a risk for. And I feel like this is the field, this diagnostic ways, several different biomarkers will hopefully give us that answer and get us closer to when when is that baseline?
Yeah, exactly. So, so the company that you're with, one of the things that you guys are working hard on is, and I'm gonna let you fill in the blank. If you were to describe what is it you're working really, what are the researchers working really hard on doing, understanding, exploring, digging into? What would you say?
Great question. And I really appreciate you asking me that question. So, life molecular imaging, our baseline goal is absolutely right now to educate clinicians, researchers, patients, and caregivers in our community in general to understand the importance of these imaging biomarkers in the diagnostic pathway of dementia, Alzheimer's disease, and several other differential diagnoses. So amyloid, our amyloid tracer will, of course, will give us that initial amyloid plaque answer. But when we later in the disease, we also want to make sure that there's a tau scan. As we know now, tau buildup is more closely related to the decline than amyloid is. And just through our research, our hope is that we put or shed some light on the importance of these imaging biomarkers. And with the help of you and with the help of our clinicians and our researchers who are working on our studies, both nationally and internationally, will get us closer and closer to accurately diagnosing. If that, and hopefully then, my apologies. Hopefully then we will have the answer of how does that play a role into all these novel therapies that are lined up, and see the role of imaging into accurately assessing how well our therapies are working.
Cool. Now, since I care a lot about Lewy body disease, I and among the other dementias, the one missing tracer perhaps, or and I think it's doable, but you tell me if it isn't, is synuclein protein malformations, alpha synuclein. Is that something that you guys at this point you're just not looking at, or because you're primarily looking right now at Alzheimer's and the beta amyloid and the tau, that it's not something right now? Just sort of tell me about that part. Tell us about that part.
This is a great question. It actually gives me an opportunity to give you an opportunity to look into our pipeline. We do have alpha-synuclein tracer that's currently in the preclinical stages. Okay. So before we can talk about it, there's probably long ways to go, but it's certainly in the pipeline.
And what the reason I'm excited about that is I think for older clients who are in that upward of 75, 85, 95 for sure. I think one of the things that it seems like we're finding out more is there's more mixed picture dimension than there is a absolute only this and only this. This is the only thing you need to be worrying about. It's just this. More than ever, we're starting to appreciate, ooh, this is like a party. Once you start with one thing, it's sort of like everybody wants to come and have a drink. It's sort of like this happy time, but not really for your brain. But abnormal protein formation, this cascade event, seems like there might be some things to explore there about this multidimensional phenomena.
Absolutely true. And I'm sure in the world of research, you might have heard of what we now know as ATN framework. So there's amyloid, tau, and neuroinflammation. Of course, we don't have a definite answer yet, but hopefully soon we'll figure out what it's kind of, still in the stages of, I don't know if this is the right way to put it, but we don't know whether we can say confidently if amyloid comes before neuroinflammation does, or we just don't know. But we're looking into that, and that's where connecting the dots part will come into play, and hopefully we just kept getting our science better and better.
Yeah, because the idea of how will we treat this more effectively if we aren't really clear about the cascade of events and how one links to the other and how one impacts or influences the other. So in many ways, we want to be further along in the science than we are. I mean, we would love to be so much further along, but it's incredibly complicated. So,
Absolutely.
so as
Yes.
we
Hi, I'm Tifa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching, and if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out, and you might want to visit our website, www.tipasnow.com, where you'll find other resources as well. See you there.